Hello again. This is the second part of my class. I'm Seven Song. Hello. Of herbal medicine for internal and external infections. And what I've covered so far is categories of plants, some specific plants under those categories, and some basic considerations of infections. What I want to do now is cover some specific infections, 4 of them, and discuss what herbs I use for them. So this is not really for treatment. Let me get this. I'm trying to be clear. I want this class to be practical, and I want this information to be useful. But what I'm not going to do is cover the details of, let's say, the respiratory infections or staph infections. So I want to give an overview of the herbs that I use for these infections. But if you're actually treating staph or Lyme disease, let's say, you would need more information than this as well. So I hope that makes sense. And I hope you're enjoying this class. With each pathology, with each kind of infection pathology, there'll also be subcategories, and I just want to mention those with them. So for instance, as I said previously, with like dental infections, you also have to deal with pain. With respiratory infections, you also have to deal with coughs. So I'm going to focus on the herbs for the infections and why I might use them and the categories for those. And then I want to include some of the other categories, often for symptom reduction. So let's start with staph infections. Staph in first aid is really common. I've treated hundreds of cases. I've worked with hundreds of cases of staph infections. So one of the first things you have to figure out with a staph infection, there's a number of things. The first is, after you decide it's a staph infection, is to work with your patient and to see if they want to take antibiotics or herbs. So I've written extensively and talked extensively about staph, so I don't want to go into the details, but that's actually just an important beginning, because it might be easier for them to just go to a clinic or a hospital and take the antibiotics, depending on what kind of staph they have, rather than doing the herbal treatments. But some people want to do the herbal treatments. It also means they can stay where we are, like some gathering that's in the wilderness someplace, to do that. And then, of course, at one point, I would say, like, this is too much. This is spreading too fast. It's in place in your body that could leave scarring. And I suggest that you go get conventional medical care. So staph. So staph is the abbreviation of Staphylococcus aureus. What I think a lot of people don't realize is one of the most common bacteria on our skin. It's a very common, so let me change that statement. It is very commonly found on people's skin, mostly in their armpits and their respiratory tract. And it's found like between 30% and more of people in the United States on a regular basis. In other words, it might be commensal. The staph bacteria lives on us. Maybe it gains something. Maybe we gain something. It's not sure. It probably gains something, but it's not necessarily pathogenic. And then, whether it's the strain of staph that's on you, or the newer staph, or that your immunity has been changed, all of a sudden that Staphylococcus aureus, the staph infection, which is a bacteria, then becomes pathogenic and starts to get into like hair follicles, where it becomes folliculitis. It can get underneath the surface of the skin, and then it becomes cellulitis, or it just eats away at the surface of your skin, which is just your common staph infection. But if you have an infection on your skin and you see pus, and the wound is getting worse rather than better, there's a good chance you have staph. And then these are some ideas for that. So there are multiple strains, and this is often how they're divided medically. So there's staph, just like the Staphylococcus aureus, and then there's MRSA, and there's also VRSA. Well, I'm not going to move into that one, but MRSA is methicillin-resistant Staphylococcus aureus. All right, MRSA, yes. So MRSA is basically, it's an antibiotic methicillin-resistant MRSA, MR, and then SA, Staphylococcus aureus infection. Sorry, to go on for this, but MRSA is basically one that some antibiotics don't work for, and sometimes it's just a much more proliferative strain and harder to stop herbally and non-herbally. You can't really tell what's MRSA and what's not just casually looking at it without medical equipment, without lab equipment. So my concern, though, is not MRSA or not, because I'm using herbs. My concern is how quickly it's spreading and where it is on their body. Excuse me, I got an itchy nose. I think I get an itchy nose a lot when I talk on camera. There must be maybe I'm allergic. My nose is my left nostril is slightly allergic to talking on camera. So just to put kind of a point to it, there's about a couple of years ago, the last statistic I have, there were 500,000 or 500,000 cases of hospital-acquired MRSA. So in 1 year, I'm not sure which year, but a recent year, maybe somewhere between 2016 and 2019, there was 500,000 cases of MRSA or Staphylococcus infection acquired at hospitals. I'm just saying it's very common. The next is a little tricky, and that is often people who have staph infections think they have spider bites. And the reason, it makes sense why you would think that, because basically you wake up in the morning and all of a sudden you're looking and you have these holes in your body that are getting worse. And you didn't feel a bite, you didn't feel an infection. And so staph and spider bites have that in common. You don't feel them coming on necessarily. And they just show up. And since nobody really wants to have staph and spider bites, they seem a little cooler to have than a staph infection. Excuse me a second here. That often people think they have spider bites. So you have to diagnose most of the time. So this is true in the hospital situations and medical situations, and what I find in wilderness situations, most of the time it's not spider bites, it is staph. The importance is they're treated differently. A spider bite could get infected with staph. You have a hole in your body. Now you have a place for the bacteria to grow in. But in general, when people have an infection that's getting worse and is pussy, it's not a spider bite, unless it's in a very specific area. I'm really sorry. Now I'm concentrating and I'm focused on the itchiness in my left nostril. That the people have, they've heard of spider bites, they see it, they just don't know where it came from. But the treatment is different, because a spider bite is a venomous bite, and you have a venom in your body, and so it can cause different reactions. And then staph is a bacteria. And so here's what I'm trying to say. Most people that I've met that think they have spider bites because they have a hole in their body that's getting larger have staph infections. There are cases where it is a venomous spider, but by far the most common. And then if you just read the statistics, that it's true in hospital settings as well. All right, enough said about that. It is an interesting thing. I don't know how many people have come up and said, I have a spider bite. And I go, it looks like staph. They're like, I'm sure it's a spider. I'm like, did you see the spider? Because you pretty much never see the spider. They haven't. But then, there are places where you could get spider bites. And I'm talking way too long about the difference between spider bites and staph infections. So treatment protocols. Basically, once you decide it's staph, then you talk to the person and decide whether they want to take antibiotics or herbal medicine. You want to tell them what's involved with taking herbal medicine, how often they might have to take it, which is daily. And they have to clean their wounds more often with it. So again, I don't want to go into all the specifics. I have videos, I think, somewhere about staph infections. I wrote an article recently about it, and probably have it online as well on my website. So, and all that stuff is for free. So treatment protocols. Next is just make sure that, so staph is very contagious, and you want to make sure that you get rid of all your waste products or clothing and clean them thoroughly. So if you're cleaning your staph wounds with gauze pads or whatever you're using, make sure they go someplace where nobody's hands are going to go into the garbage and potentially get the staph infection. Take care of your waste products, which is a general first aid and medical rule anyway. When you're using staph medicines, often I go between internal and external preparations. So I'll put stuff on their skin where the staph is. It could be multiple staphs. I mean, I've seen people with like 15 or 20 actively growing infections. Usually at that point, you suggest antibiotics. It's just really hard to take care of with herbs. It's a lot to clean and wrap every day. So Externally, there are some herbs to use, and internally, there are some herbs to use, and often they're the same herbs. Don't use oils. Don't use essential oils. I haven't used much essential oils, but don't use infused oils like fixed oils because you don't want to trap that staph in there. Well, you really not trap it. You don't want to give it that slightly anaerobic environment that it appreciates. To use external preparations, there are two, and I alternate or stagger between them, and they are activated charcoal and liniments or tinctures with herbs. So I'll go over some specific herbs in a bit for external combinations. But basically what I'm going to do with the activated charcoal, I'm going to make it somewhat moist, kind of mud pie consistency, and spread it on a gauze pad, whatever gauze pad is needed to cover that area, and make it slightly thick. So I have muddy activated charcoal. You don't want to add tinctures to activated charcoal. You just want water. There's a whole reason for this, and the reason is the activated charcoal will adsorb, remember that AD, will adsorb the tincture and make it less useful and make the tinctures less useful. So you're just going to use water when you apply activated charcoal internally or externally. So I'll keep going now. So you take the activated charcoal and basically make it slightly muddy, and then you apply it on a gauze pad so it's kind of slimy on there. And you can apply it directly if the wound is not too deep, or you can make a sandwich with it. So you have gauze pad, activated charcoal, gauze pad, and you apply that directly onto the staph infection. Do not use tape to hold it in place. Use vet wrap when possible. So vet wrap, I should have some with me, is a thin, like elastic bandage that self-adheres to itself, but it doesn't have tape. The reason is when you take it off, which you're going to be changing it daily, you don't want to pull hairs out near a staph infection, because the staph can then go into those places where the hairs have been pulled out and make multiple staph infections locally. So use vet wrap to hold it in place. If it's someplace like a staph wound on somebody's butt, which I've seen numerous times, you can use Medipore, which is a special kind of tape that you can read about to hold the gauze in place. So the idea is you don't want to do more damage. You want to pull hairs out when you're putting the activated charcoal poultice in place. So it could be activated charcoal, just lay it flat on, put on if the staph infection is not very deep. If it's very deep and you don't want the charcoal getting in, you take the gauze pad, activated charcoal, another gauze pad, and you apply that onto it. So making basically a sandwich out of it and hold that in place. So that's one way you can do it. And the other, one form of medicine. And the other external is that you just use some herbs. And so let me go over some of these herbs that you might use externally. So you can use liniments, or you can use tinctures. Both work. Again, the only reason you use liniments is just less expensive. So you take your 2x2 or 4x4 gauze pad, whatever size it is, and you moisten it lightly with these herbs. So what I want to do is I want to give some possible combinations and describe what each herb does in these combinations. So this is external application for staph infections. You're definitely going to still give them stuff internally. So you're going to be doing both. So an external application might have something like 3 parts Japanese barberry, Berberis lundbergii. So this is a tape. You can just stop this and go back. I talk too fast. I am a New Yorker. Myrrh, so myrrh resin, also 3 parts. I'll repeat each one after I finish it. Witch hazel, the inner bark. So not the store-bought witch hazel, but your own tincture or liniment of witch hazel. And licorice root. So I said I don't use licorice root much, but actually there's some evidence that it can help with staph infections. And that would be 1 part. So it's Japanese barberry, 3 parts. Myrrh, 3 parts. Witch hazel, 2 parts. And licorice, 1 part. The licorice is anti-inflammatory, and it looks like it might have anti-staph qualities, the licorice root. The witch hazel is an astringent, so helping tighten, heal the area, helping with the skin infection. Also, the antioxidant qualities of tannins would be found in witch hazel. And the other 2 are antibacterial, the myrrh and the Japanese barberry. So I put them in, I'll have like a small cup, usually a plastic 3-ounce cup, and I stir them in there. And then I just put the gauze pad in there and lightly moisten it and apply that directly and hold it in place with vet wrap or Medipore if I can't wrap it around the person's body, like an arm or a hand or a leg or a foot. Here's the next one. So another way to do this is you can use chaparral, propolis, uh, white oak, and willow. So the chaparral is going to be 3 parts, and the chaparral is antibiotic or antibacterial. The propolis is also antibacterial, and that's usually 2 parts, and it helps everything adhere. So, all right, so you could do this any way you want. Like you can mix and match and use different parts. So I give numbers because often people like the numbers. It's appreciated to have like kind of a set formula, but definitely play with these things. Like it also depends on the strength of your individual herbs. Back to our formula. So as I said, it's chaparral, 3 parts. It's usually the leaf of the plant. Propolis, resin, 2 parts as an antibacterial. White oak, inner bark, 2 parts. The white oak is an astringent, antioxidant, and to promote wound healing. And the willow is anti-inflammatory because anti-inflammatories just help the area heal quicker. And that would be 1 part. And those are, again, put them in a cup, moisten, and put them on internally. Put them on a gauze pad and use it externally. The next are internal medicines for staph infections. And so these are taken internally orally. Some of these, there's multiple categories, but with staph, often you're really just trying to kill the organism and stimulate your body's resistance. So you could put immune stimulating herbs like astragalus in there, or ceanothus red root. But in general, the herbs are more about killing organisms that I'm giving internally, just stimulating white blood cells to do that. Often your initial dose is pretty high, between 4 to 5 milliliters. So your loading dose is, nearly a teaspoon to a teaspoon for an adult that can take that much. Let's say it's a tincture. Some of these will work in glycerin, and some of these won't. So these are internal medicines for staph infections. So our first combination would be Oregon grapefruit, 3 parts, antibacterial. They're all antibacterial. Well, that's not true. Echinacea root, 3 parts, and then black birch as an anti-inflammatory, and that would just be 1 part. So we have Oregon grapefruit, 3 parts, or any plant in the genus Berberis. Echinacea root, 3 parts, antibacterial, immune stimulating, and black birch, 1 part, anti-inflammatory. Another example for staph could be, echinacea. I use a lot of echinacea with staph because you're really trying to stimulate immunity. Make sure the person doesn't have a difficulty because of an autoimmune condition, and echinacea. So echinacea root, 3 parts. Myrrh, 3 parts. Myrrh is antibacterial internally. Yarrow, antibacterial and anti-inflammatory internally, 2 parts. And licorice, anti-inflammatory, 1 part. So that last one's echinacea, 3 parts. Myrrh, 3 parts. Yarrow, 2 parts, and licorice, 1 part, internally for staph. That's it for staph. Moving on to dental infections. So they're extremely common. There's lots of reasons for them. One of the real reasons, though, is food. It's the food we are fed and is commonly given, has lots of things to stimulate bacteria in our teeth, including sugar. But the other reason is dental care is unaffordable for many people, and so they only go when they absolutely must, and so then they have lots of teeth problems and then gum problems due to that. So I'm going to go through some of the dental considerations, and then we'll go for some specific herbs. I hope you're staying with me with this. I hope it's working out well. It's, the thing about teaching on camera is, first I talk to myself, and without much feedback. So with dental infections, meaning holes in your teeth and gum infections that have some bacteria or some other organism, usually a bacteria growing in there, the first thing is they're extremely painful, right? As I talked about very early on, the trigeminal nerves, and these nerves feed back to the head very fast. And so you're pretty much always giving pain remedies and anti-inflammatories. As the infection grows in the teeth, as the infection makes inflammation, it presses against your gums, which don't have a lot of space, and that pressure in your gums causes a lot of pain. So anti-inflammatories are very helpful for dental pain. Anti-inflammatories are very helpful for dental pain. And that would include things like aspirin and ibuprofen and other NSAIDs for non-steroidal anti-inflammatory drugs for dental pain, but also the herbs, of course. The herbs are often swished to get the herb into the area in the gum and kind of keep it there and move it around. And sometimes you can swallow the herbs, and sometimes you can spit them out, depending what the combination is and what your goal is. But often you're going to take herbs internally for infection as well as using them externally. So again, swishing them, swish and spit, or swish and swallow, depending on what you feel comfortable with and what the herbs are. I want to go to one of the ones that's used very commonly, and it's mostly for the pain, and it's Clove Essential Oil. So Clove Essential Oil is an analgesic for some people. I find that maybe 1/4 of the time, so that's not too bad, 1/4 of the time useful, and then the other 3/4 of the time not very useful for people's pain. But when it works great. It's inexpensive, easily purchased. So Clove Essential Oil, basically, usually you put it on a cotton swab and you apply it directly on the area and you hold it on the area. The advantages are all the things I've said, but I want to say there's a disadvantage. So Clove Essential Oil also destroys local tissue. Like it frays. I don't really know the best word for that. It frays local tissue. So don't swallow Clove Essential Oil, right? Spit it all out. You don't want to swallow it. It's not good for your tissue, but it is a topical analgesic in your gums. I don't know where else. It doesn't work so much on the skin. So, but when it works great. So you basically, you take your bottle of Clove Essential Oil, it has a little droppy things in it, and you put it on the Q-tip, and you just hold it in place and use the other side of the Q-tip, or you just keep holding it in place and spitting out the extra. Try not to swallow it. Small amounts of swallowing is fine, but you don't want a lot of it in your body. So it's an analgesic. And so there's two other analgesics, and these are going to be controversial, but I'm going to say them. So when people have really terrible tooth pain, sometimes one of the things you can do is you can help reduce it with either cannabis, formerly called marijuana. So in this case, we're actually talking about maybe a THC-rich cannabis. And so some people, if they smoke or take cannabis, it will increase their feeling of pain. Like, this if you've ever used cannabis, that for you, if you take it, you either relax, or some of the time, and other times you take it and you just can't stop thinking about everything around you. It makes you a bit paranoid. It makes you feel your pain. So it depends on the person, but for some people it helps. And the other, again, is even more controversial. It's just drinking some alcohol. So you can swish and swallow it, but the alcohol for some, here's why I'm saying this. Sometimes when people have really terrible dental pain, they're just screaming and crying, and I don't blame them. It is extremely painful. And so anything to reduce the pain. So of course you can give herbs that I'll mention, but these are things that you might have handy if you don't have herbs that reduce it. They only reduce it temporarily. And if the person drinks a lot, they're going to fall asleep and wake up with a hangover with a toothache. So that's not pleasant. But I'm just putting out obvious considerations for them. So the clove oil is an analgesic. These other two really just like, they numb you out if they do. And of course, never use alcohol for people that don't use alcohol, ever, ever, ever. So we have anti-inflammatories. My favorite anti-inflammatory that I mentioned for tooth pain is licorice root. So the licorice root, you could use it in form of medicine. What I find is if you actually have licorice pieces, not Twizzlers, not Panda candies, but a piece of licorice root, they chew it on the good side, because one side's going to hurt and one side might not hurt. You chew the licorice root if possible and let like the licorice juice and saliva move into that area. And I've seen that be helpful to reduce pain as an anti-inflammatory. So it's not an analgesic. And then two other ones that I've already mentioned as anti-inflammatories that you take internally for the inflammation that causes so much dental pain. And that would be black birch, Betula lenta, and willow, Salix species. You can use astringent herbs to help, after the pain is stopped, to help the abrasive tissue, the frayed tissue that might be in there to help heal. And also astringents have antioxidant qualities. So again, they have vulnerary wound healing qualities that are useful. So I want to just mention a couple of useful astringents. Astringents have tannins. Tannins help tissue bind closer together. They pull proteins closer. So it's helpful that way. So some of those would be Yerba Manza, which is Anomopsis californica. Myrrh. So myrrh is like the tooth remedy because myrrh covers like 6 bases, maybe not that many, but myrrh is really useful for dental infections and gum infections. It's just myrrh is very specific for our teeth and mouth because of many things, but it's also astringent. Witch hazel, again, not the store-bought stuff, but your own. You gather witch hazel and make your own medicines, which is Hamamelis virginiana, witch hazel. Hamamelis virginiana. Next is Prunella vulgaris or self-heal. Self-heal, Prunella vulgaris, astringent. And also oaks, and especially white oak, Quercus alba, but all oaks have astringency and are non-poisonous. Next are antibacterials. These are things that you want to have come in contact with your infected area in your mouth and also potentially swallow these. And so we're going to have some of these are repeats. So I just said them. So Yerba Manza has antibacterial qualities. So Yerba Manza is Anomopsis californica, a lovely plant. Oregon grapefruit and Japanese barberry, which I've mentioned many times because they're my favorite herbs for multiple reasons, for multiple infections. So they're going to show up in the next couple of these. So berberis species, Oregon grapefruit, Japanese barberry, maybe agarita or algarita in the Southwest. They're all berberis species. They have many names, the plants, depending where they grow. We have myrrh again, echinacea again, antibacterials, immune stimulating. Chaparral, I don't use it so much for dental stuff. It's just so strong tasting. I usually use it more externally. Pine resins and propolis. We've talked about these previously. And two specific, or the most specific gum tonic again is myrrh. There's just so much it's helpful for gum infections and dental caries. It doesn't heal the caries; those are the holes in the teeth, but helpful for the infections beneath them. All right, you have 2 more to go. This has been a really, yeah, I think the minimum was like supposed to be a half hour, the maximum an hour. So let's see if anybody actually is watching this. If you are, I hope that is helpful. So the next one is Lyme. So again, there's so much involved in Lyme. It is such an important thing to know about and to treat yourself and other people. But this is just a kind of a superficial overview of Lyme infection and some of the herbs and some of the ways to work with Lyme. So Lyme affects multiple parts of the body. It can affect mental function. It can affect joints. It can affect, well, those two, body pain. So Lyme, the Borrelia bacteria, you can try to kill the infection, the Borrelia. That's difficult to do. So with this as a bacterial infection, your goal is often to help reduce symptoms over the course of time and try to maybe kill the Borrelia bacteria. It's hard to know if the herbs really do that. It's best to hit hard and heavy right after you have a tick bite. I just want to say it. I think if you have a tick bite and you're not sure, antibiotics are the way to go. I don't know if the herbs work. There's no testing them. And so I know that's a problem because many people get bit over and over. You don't want to take antibiotics over and over. And I don't have a good answer to this. But when people ask me, should I take the antibiotics, and you're unsure, that's a personal decision. But if you think you have Lyme, I would suggest taking the antibiotics. And there's different courses you might take in the very early stages. So by antibiotics, I mean conventional antibiotics. And usually I mean doxycycline is the most common for this. So, Lyme is just very contentious because the tests are often unreliable. Lyme mimics, or there are many human health problems like chronic fatigue syndromes and fibromyalgia that have the same symptoms. And so it's very difficult to know. So I want to read the symptoms that are associated with Lyme, but these are associated with many health conditions because this is the place the body goes to often when you have infections and other disturbances of your normal homeostasis. They include lethargy, which is very tired, body pain, joint pain, Brain fog. Brain fog means it's difficult to like think clearly. Memory seems impaired. Anxiety and depression, different than brain fog. Headaches and fever. So you know that those go with lots of things, but they also can go with Lyme. And so I'm not going to go through herbs to go through all these things: fever, headache, joints, brain fog, body pain, and lethargy. But just knowing that these can be related to Lyme and to multiple other health conditions is tricky. Lyme also had ticks, excuse me, also can carry other what are called co-infections. There's a couple of bacteria that can be co-transported with Borrelia or be on their own. Those include things like anaplasmosis, babesia or babesiosis, and ehrlichiosis. Ehrlichiosis. That's what it is. It's ehrlichiosis. And these are, I shouldn't be laughing at the diseases, just my mispronunciation. But these are common bacterial infections. How common they are really varies. Depends on the area you live in and the amount that have ticks. The bacteria that causes Lyme disease is Borrelia burgdorferi. And that's the one that causes Lyme. These cause different diseases. So in other words, you might not have Lyme, but you might have one of these. This is what happened. This is what it's like to own a human body, or any body. All bodies get sick. It just depends what they do. Well, to finish that better, all animals get sick, basically. I guess if you live really quickly, like if you're a fruit fly and you live for a day, I'm not really sure what happens there. That's just a fly stage. You also have a larval stage, just in case you were wondering about fruit flies. So one thing that happens often with ticks is the mouth parts stay in the body, and you might not have Lyme. So I'll say this. Sometimes when you're pulling the tick out, the best way to pull a tick out, by the way, is straight out slowly. Just kind of annoy it so it finally lets go. But sometimes eventually you pull it out and the mouth parts are still in there. If the mouth parts are in there, they create their own sense of infection. They could be itchy for days and weeks, but that's not Lyme. So when you have a tick in you for a long period of time and you pull it out and it's itchy, you could have Lyme because the tick's been on you. But if it's just the mouth parts, they don't give you Lyme. The Lyme comes, the bacteria, the Borrelia comes from the abdomen, the stomach, and it gets excreted into you as the tick feeds. So it's hard to know if you have Lyme or not if you pull the tick off and the body parts stay in you, the mouth parts. But I just want to say that they present their own problem of very strong itchiness, but it's not necessarily Lyme. So I hope that makes sense. So a lot of these herbs I mentioned. So at this point, I'm just going to start to say the different categories and herbs that I give, and go with less detail since I've covered many of these. So I definitely, when people have long-term Lyme, I give them herbs to help increase bioavailability in their body, and that would be cayenne and prickly ash. Prickly ash if they're sensitive to spiciness. Also, I think prickly ash sometimes works a little better. I'll keep moving though. So these are herbs that I add to internal. Mostly I treat Lyme internally. I pretty much, sometimes I'll put something on external, but really it's an internal problem and you have to really go for it. So you have to give a lot of herbs for a regular basis, days, weeks, months, years. And so if I'm giving them internally and they've had this infection a while, I want to make sure those herbs get distributed well from the GI tract into the bloodstream, into the tissue. And I'll use cayenne, capsicum species, and prickly ash, xanthoxylum species, though I like, my favorite prickly ash is Xanthoxylum clava Hercules club. There's a few plants called Hercules club. The next are antibacterials. It's a bacteria. The new one here, I don't really know how well it works. So I'm starting to experiment, is Andrographis as an antibacterial. And then we have like some of the ones I've talked about: yarrow, Achillea millefolium, myrrh, Commiphora species, echinacea, and berberis species, like Oregon grapefruit and Japanese barberry. I've also using Baptisia tinctoria, wild indigo. I said that I mostly used wild indigo previously as an antiviral, but I've been trying it from some of my friends who use it as an antibacterial for Lyme disease. Lyme is not, you can get a virus infection. I don't actually know what viruses you can get from a tick. You can get bacterial and other diseases though. Then we're going to use anti-inflammatories. I'm going to add a few new into this. So Lyme disease often has inflammation in the joints. So these are anti-inflammatories, often specific for the joints. We have blackbirds once again. I love it because I love the smell and taste of wintergreen, and it grows around me. That's Betula lenta. A newer one that I use specifically for joint inflammation is devil's claw. Devil's claw, not any other devil's thing. That's Harpagophytum procumbens. Harpagophytum procumbens. Feverfew, Tanacetum parthenium. Licorice, Glycyrrhiza. Turmeric, Curcuma longa. And feverfew, excuse me, I've said feverfew, willow, Salix species. So anti-inflammatories include black birch, devil's claw, which I use the most because it's the best for joint pain. Feverfew, which I still use a lot of. Licorice, I use a lot of that as well. And then turmeric, I use less of for this, and then willow. Sometimes there's connective tissue damage to people's joints after they have Lyme disease. And so 2 herbs I use for connective tissue repair are Salomon seal, connective tissue repair, Salomon seal, which is Polygonatum species. Please be careful while crafting this. This is a plant that's pretty easy to grow in many places, in shady places. So grow your own Salomon seal. It's the rhizome that's used. So it's Polygonatum species. And then Gotu kola. So Gotu kola is Centella asiatica. So these are connective tissue repair. I'm going to keep moving through these. If there's a lot of fatigue associated with the Lyme, which often there is, you can use things like ashwagandha with Aenia somnifera, Eleuthero ginseng, Eleutherococcus centicosus, and chamomile, Matricaria chamomilla. To increase immune system surveillance, these are some, so I'm not going to go into the details on many of these. I think I'm like an hour and a half over, excuse me. Well, at least you can turn it off at any time and maybe watch something, stream some good movie. So these are immunity and lymph herbs that can be helpful for long-term infections, and they include Astragalus, Astragalus propinquus, formerly Astragalus mongolicus, Eleuthero ginseng again, Eleutherococcus centicosus, milk thistle, potentially. I haven't used this one much, but I'm considering it. Salibum marianum, red root, not bloodroot, red root, Ceanothus species, and reishi mushrooms, Ganoderma species, reishi Ganoderma species. So immunity herbs include Astragalus, Eleuthero ginseng, milk thistle, red root, and reishi. There's a couple of herbs that could be helpful for mental health. This includes things like, right now, this is more about memory and about brain fog. So if there's brain fog is a part of Lyme, some herbs to consider are calamus, which is Acorus calamus, ginkgo, Ginkgo biloba, rosemary, Salvia rosmarinus, formerly Rosmarinus officinalis, rosemary, and Gotu kola, Centella asiatica. Again, Gotu kola does a lot of things positively. If there's a lot of anxiety and depression, I think instead of reading a list, if there's a lot of anxiety and depression, well, I will read a list. Here are some herbs that are good for anxiety and depression. They include things like there's panic attacks, anemone, way too many thoughts, too linear thoughts, could be blue vervain. I'll just go through these. For anxiety, you have things like anemone, blue vervain, Verbena hastata, chamomile, Matricaria chamomilla, Damiana, Turnera diffusa, Kava kava, which can also be sedative, Piper methysticum, lavender in small amounts, Lavendula species, Lobelia inflata. That's a tricky one. I'm not going to go into it, but you can look at Lobelia's relaxing qualities. Motherwort, Leonoris cardiaca. So Leonoris, these are mostly for anxiety. Rosa species. Skullcap, Scutellaria lateriflora. St. John's wort, which could be helpful with depression as well. Here comes the itch. St. John's wort, Hypericum perforatum, and Tulsi. So I'm going to read that list again, just go through it. Anemone, blue vervain, chamomile, Damiana, kava kava, lavender, lobelia, motherwort, rose, skullcap, St. John's wort, and Tulsi. For depression, things like St. John's wort, and another one for depression, but don't use if people are bipolar or people have bipolar tendencies, and that would be mimosa or Albizia julibrissin. I'll say that again. So one herb that could be useful for depression, but be cautious if there's bipolar tendencies in a person because it could push them, and that is the mimosa tree, which is Albizia julibrissin. So St. John's wort and mimosa more for depression. The others are mostly more for anxiety. And that takes us to our last category, which are respiratory infections. And most of the things we've covered have been bacteria. The dental infections are usually bacteria. The Lyme is a bacterial infection. And whatever the first one was, staph, excuse me, is a bacterial infection. And so we're going to cover some respiratory infections. Of course, COVID is a respiratory infection. Respiratory infections, meaning colds and flus, coronaviruses, and influenza viruses, are viruses. And so now you're going to have to kick it up and use more antivirals. Respiratory infections could affect the sinuses, the throat, the bronchi, and the lungs. So basically anywhere from here to in here. If people have colds or flus, I just want to say there's some useful differentiation, like whether it's a cold or flu or something else. I find this in wilderness situations, particularly people think they have a cold or flu, or they might have these things. So I just want to mention things that look like colds or flus. Allergies, though allergies almost always have clear mucus and never have fevers. Congestion from irritants in the air, like smoke, fire, well, smoke really. So if you have a lot of smoke coming at you, and there's been, of course, a lot of fires, unfortunately, in the US and other places in the world, that smoke will cause a lot of congestion and a lot of drippiness, and it can look superficially like a cold or a flu. The reason that I'm mentioning these is your treatment is different. Like if you have allergies, you want allergy medicines. If you have congestion from irritants, you want something to help with congestion. You don't need anything to kill bacteria. And then if you're just, if there's a dry heat source inside your house and it's winter and you have a wood stove, that could just irritate the nose and give congestion and make it look like a cold or a flu. So you have allergies and irritations are two things that can imitate colds or flus, and they're treated differently. So with colds and flus and respiratory viruses, you might have to change your herbs depending on your group of symptoms as they're happening and depending whether it's acute or chronic. So like I might start off with one group of herbs that, let's say, are more centered towards respiratory inflammation, and then I might move towards another group of herbs that are more centered around a cough or a fever. So in other words, the herbs might even stay the same, but the proportion of each one in the formula and how often you take it might change throughout the course of a cold or a flu. If it's an acute one, like you just got really sick and it's not COVID, maybe any respiratory infection really, just hit hard and heavy initially. To get your body stimulated, use some of the herbs that will stimulate your body's immune system, like echinacea in the beginning, and go with like 5 mils 2 to 3 times a day. That, by the way, is half a 1 ounce bottle. But you just want to get your immune system stimulated and working to fight the virus. All right, so treatment, anti-inflammatories, because there's a lot of inflammation. I want to point out, though, that there's 2 herbs that are anti-inflammatory for the respiratory tract, and I just want to mention them. And I've been using a lot of them. So since COVID, respiratory inflammation has been very common in the communities I've worked with that have COVID, that are not on ventilators, that are at home, but still having difficulty breathing. And the first one, so these don't help with breathing directly, they help with reducing respiratory lung, bronchi inflammation. The first one is elecampane, and that's Inula helenium. That plant, fortunately, it's gotten weedy around this area of upstate New York because I'm using a lot of it. And the root of elecampane or Inula helenium, there's lots of stuff that plant does, and you can research it more. And mullein leaf. So I think elecampane is stronger. I actually know less about mullein leaf, though it's more common. But mullein leaf also looks like a bronchi anti-inflammatory. So it's useful if the person has chest tightness or anything that feels like they have inflammation in their chest. And of course, if it needs to be seen by a medical person, do that. So then there are just other anti-inflammatories that you can use. I've covered almost all of these. They include things like yarrow, Achillea millefolium, licorice, Glycyrrhiza glabra, Glycyrrhiza urulensis, chamomile, Patricaria chamomilla, and Salix willow. So these are anti-inflammatories. They can be useful for respiratory inflammation. We have antibacterials. So I'll just read these because I've been saying them. I'm saying both names so you have a minute to write them down if you don't want to watch me again. I don't blame you for that. So you have garlic, mild but commonly used and commonly found and inexpensive antibacterial here, which is Allium sativum. Onions also have antibacterial properties, Allium cepa, Allium cepa onions, but I use garlic more. The berberis species, these things are probably sounding very redundant, Oregon grapefruit and Japanese barberry. Boneset with that disclaimer or that proclaimer or that safety warning I gave before. Boneset, Eupatorium perfoliatum. Eupatorium perfoliatum is very specific. So I'm putting an antibacterial here because it does show up, but I think it's more antiviral. But anyway, boneset is one of your classic respiratory helpful agents as an antiviral and as an antibacterial. I just looked up some information and there was some studies on it being antibacterial, so I'm including it under this category. And then chaparral, I don't usually use it too much. It seems very strong for cold or flu, but it's another herb that does have antibacterial qualities. You have antivirals, and they include Bactesia tinctoria, wild indigo, Bactesia tinctoria. Boneset again, Eupatorium perfoliatum, and of course elder, Sambucus species. There's some Sambucuses, some elders you don't want to use, but there's a number like Sambucus canadensis is useful, Sambucus nigra is useful, Sambucus mexicana is useful. They actually look very similar, these. They're the flat top flowers rather than the racemosa, Sambucus racemosa, which people don't use. It has a raceme. These are all flat top, the flowers. There are some herbs that are helpful for coughs. Probably my favorite, well, it is my favorite, it's going to be wild cherry. So this is just for coughs. Antitussives is the category. That's Prunus serotina. That's wild cherry. Also, you have mullein leaf, Verbascum thapsus leaf, mullein leaf, coltsfoot leaf. I actually haven't used much coltsfoot leaf. I hope to someday. Coltsfoot leaf is Tussilago farfara. Those are some good ones. Wild cherry, mullein leaf, and coltsfoot leaf. There are also decongestants you can use if there's a lot of congestion, if you have a respiratory infection. I'll name these. They have different potencies. We come back to Yerba Manza, which is Anomopsis californica, as a decongestant. Horseradish, which is weedy in my garden. That's actually weedy around my yard. Horseradish is weedy in other places. I've seen horseradish be really weedy in some of the arroyos around New Mexico. So that's Armoraceae species. Horseradish, which obviously breaks up sinuses and delivers that heat and delicious on matzah. You also have, it's a weird one to say now, but you have beggar ticks. That's not weird. The genus of beggar ticks is Bidens, just like that other person's name. So Bidens, beggar ticks is a great decongestant, very gentle, very common. So beggar ticks, which have another common names, are the genus Bidens, and they're a common decongestant. You also have Yerba Santa, not Yerba Manza, but Yerba Santa. That's Areodictian. So again, these are all decongestants for stuffy nose and stuffy sinuses. So that's Areodictian, Yerba Santa, Areodictian. There's a number of species there. And that's it for that. Let me just make sure if we go in through here. If there's a lot of pain in the chest, sometimes demulcents feel good, like slimy herbs can be helpful. So your demulcent herbs include things like slippery elm, Ulmus fulva. So in other words, all right, so your respiratory tract feels inflamed and painful, like it hurts to swallow, you feel dry, maybe your face feels dry, and your throat feels dry, so you want some slippery to add in there. You can eat some oatmeal, that's slippery, that's demulcent. You can put some honey in your medicine, that's demulcent, it will raise blood sugar. And you can also use slippery elm. You can make a gruel out of it and eat it or drink it, Ulmus fulva. Or the one that I use the most commonly is marshmallow powder. The reason I use that more commonly is that slippery elm is dying from Dutch elm's disease, slippery elm trees, and they have been in the past over-harvested. So If you can buy slippery elm from good sources, people do grow slippery elm and then gather and do it. But I like marshmallow root because pretty much everybody's, wherever you get it, it's grown, so not wildcrafted. But that's marshmallow powder. So marshmallow powder, oatmeal, and slippery elm that just moisten your body up a bit. So they're really nice for that. And that's about it. I mean, there's other things you can do for colds or flus. I've gone on for quite a while. I really hope it's helpful. My name's Seven Song, if you haven't caught it by now. And thank you for being a part of this. I hope this will help if you have any internal or external infections. And that's all I have to say for now. Thank you very much for being here.